So today we are going to talk about the manual resuscitator or BVM, bag, valve and mask. This is a manual resuscitator very famously known as the AMBU Bag. AMBU Bag was given the name after the company which invented this bag in 1953 or 1956. So it was actually invented by a Dutch company. So this is also known as self-expanding bag because when you press it, it gives the breath to the patient and then it expands on its own. It has the capacity of self-expanding itself. Why we need it? We actually manually give breaths to the patient. Those patients who are not either able to take their own breaths or they have difficulty in taking the breath or they are not able to take their breaths at all, we give them these breaths manually. So it has, when we press it, a certain tidal volume is given to the patient. It can be 500, 700 or 1 liter depending upon how much you press it. So it has got some components. One is the self-expanding bag, one is the inlet where there are two options. One is oxygen tubing through which we can give oxygen. Now this is the oxygen tubing. We attach one side of the oxygen tubing with this bag and we attach the second end of the tubing with the flow meter. So this oxygen 100% will go to the self-expanding bag. Now there are two options regarding this inlet port. Either if you do not put this additional reservoir, it will draw in the air and 100% FiO2 will be diluted. For example, if we do not place it here, FiO2 will drop to around 40 or 45. But if we apply this, which is the additional reservoir of the oxygen, and if we start giving oxygen, it will also expand because here there is a valve which is one-way valve. When we press the bag and this oxygen and air or only the oxygen, if we have put it both the tubing and the additional reservoir here, it goes to the patient, then this valve will close because this valve will not let the air go towards the additional reservoir when we press it. But when we just release the bag, then oxygen will get into this reservoir but because the valve will be open once more. So this is a inlet port or inlet side of the self-expanding bag which has oxygen tubing port, this one which you will apply here, and this has got an additional reservoir port. This additional reservoir port has got a valve in it. So we apply the additional reservoir here to increase the FiO2 concentration of the oxygen. Now this is the patient side of the AMBU bag. It has got two valves. One is the expiratory valve which we can actually close while we are giving the breath, or we can just keep it open, and this is a safety valve. Why we have it? Because when the patient is not, when we are giving too much pressure and patient is trying to breathe out, it will help to remove the breath from the patient side. So it's a expiratory valve, also known as the PEEP valve. Now there is a fish mouth valve which is on this side. If you observe closely, there is a fish mouth valve which opens when we press the self-expanding bag. This is also one-way valve. It actually allows the breath to go from the bag towards the patient, and but when the patient is exhaling, it just shuts down and the expiratory air goes from these areas. So these are expiratory holes, but this fish mouth opens only towards the patient and lets the air or the oxygen from the self-expanding bag to go towards the patient when we press it. So in order to give the breath to the patient, we apply this mask. We apply this mask here and it has got a very specific shape. So if this is the patient, this side is the patient head and this side is patient feet. This is how we place it. towards the nose is this portion and towards the face is this portion, and we make the sniffing position of the patient. We apply this mask, and before we apply this mask, we place this airway in the oral cavity of the patient so that there is no tongue fall, and the air which we give directly goes towards the trachea. So the airway is placed first. For example, if the patient is lying this way, this is the head side, we will place it in such a position that we will enter this way and then we'll rotate. Then if say this is the patient mouth, we place it, we place the patient's head in a sniffing position, and we place the mask in a way that we are making C and E. We are holding the patient head like this in a sniffing position. This is making E and this is making C. If there is a single person who's breathing, giving the AMBU breaths, one can hold with the one hand in a proper position. This makes the C and this makes E. So then you can give the breaths. Breath should be after every 5 to 6 seconds, one breath should be given. That is around 12 breaths per minute. So after every 6 seconds, one breath should be given. That should be nice and smooth. But if there are two person, one can hold the face mask very comfortably, making E and C. So that will be good for the patient, because you can, in this way you can make a better seal between the face mask and the patient's lips. So this is how you hold it, and then you give the breaths through the self-expanding bag. So if I sum it up, the AMBU bag, which is named after the company which invented it, but there is an abbreviation for it. AMBU stands for Artificial Manual Breathing Unit, AMBU. That is why this is named AMBU bag. So it has got inlet and outlet. This is patient interface through the mask. The mask should be a particular size. It can be adult size, it can be a child or pediatric size. This is the nose side, this is the face side. We can make a C and E. This is known as CE technique, where you hold the head of the patient in a sniffing position, and you first pass the airway to hold the tongue and to keep the airway patent. Then you can give breaths this way. You can give 15 liter, 12 liter, 10 liter per minute oxygen. The oxygen will go into the bag. If you are not using the additional reservoir, when you release the bag, it will self-expand and it will draw the air from the environment. So FiO2 or fraction of inspired oxygen will be diluted, and lesser concentration of the oxygen will be going towards the patient. But if we apply the additional reservoir and we keep the oxygen at a higher concentration, this will be fully expanded, and when we give the breath will be maximum of the oxygen. But if a patient is taking his or her own breath, we can just release this valve. It will actually allow the expiratory breaths to go out very comfortably. But there is the ports which allow the expiratory breaths to go out, but inspiratory goes only through the AMBU bag. So I hope it gives a little bit idea of the AMBU bag. अच्छा, मुझे अब एक बात बताओ, जो मैंने इंग्लिश में बताया